We never have a boring committee meeting, I can definitely say that. Well, one of the next things that we wanted to do, we wanted to bring, shed a little bit of light on where the money goes. We talk about raising money, and all the different things generally that it goes to. But one of the things we started talking about was, well, how do the grants get given out? And so we decided to invite Dr. Bill Phelps, who introduced himself briefly from the American Cancer Society. And he is here today to talk about how those grants get awarded at ACS. A little bit of background on Dr. Phelps. His bio has a lot of very large words in it, so I'm gonna I'm gonna steer clear of those words and just give you a little bit of background. He grew up in Memphis, Tennessee. He went to Rhodes College and got a bachelor's in biology. Then he went to Virginia Tech and got a master's in botany. And then he went to the University of Minnesota where he got his PhD in microbiology. So he's got a lot of letters. He's held a number of positions over the years, and then he joined the American Cancer Society in 2004. And he is the scientific program director, where he runs the preclinical and translational cancer research program. Is that close enough?
Sounds wonderful.
All right. Well, you don't need to hear me anymore. Dr. Phelps.
Well, thanks. It's a real pleasure to be the videographer.
Be on the web.
Right on the
No
front
pressure.
page. It's a real pleasure to be here with you guys tonight. We're in the research department. We're certainly in awe of what you guys do, because we couldn't do what we do unless you did what you do so much to raise money. So we can't thank you enough for what you do. What I thought I would do is to talk a little bit about, I think Michelle told me I had 10 or 15 minutes. She'll start throwing things at me if I go too long. I thought I'd tell you a little bit about about the research program and a little bit of the history and a little bit about what we do. Certainly, if at any point you have questions and would like to interrupt, don't hesitate to do that. Just keep this real informal. Maybe start off with the questions. Anybody know a question I like to start off with? She's back there smiling because she heard me speak just in December. Anybody know when the National Cancer Institute was founded? Kenley can't answer this question either. National Cancer Institute. Anybody know when it was founded? 1850? Anybody got a guess? About 1937. It's founded in 1937. What else was going on around 1940? World War II. World War II. But what was the big drug? There was something called a magic bullet. There was a big drug that first started seeing use, was discovered and first started seeing use in the beginning, in the end of World War II, called a magic bullet. We still use it today. Penicillin for bacterial infection. So you begin to get this notion that chemistry could produce drugs that could help people stay healthy, this notion of a magic bullet. Around 1937, you got the National Cancer Institute. Well, the ACS, of course, was founded in 1913, but it was reorganized around 1940, early 1940s, into what we know today as the American Cancer Society. A lady by the name of Mary Lasker in New York City was a socialite, an entrepreneur, a great fundraiser, had a lot of causes, but one cause in particular that she was interested in was cancer. And so she helped to revitalize the American Cancer Society, what at least in the 1940s, some people thought was kind of a stodgy organization. We won't talk about what it is today. It's not a stodgy organization. But Mary Lasker went and raised about $4 million and used $1 million of it to establish the research program. So in 1946, the American Cancer Society established a research program. And it was one of the first committed research programs to cancer. Remember, the National Cancer Institute was just founded a few years before that in 1937. So in 1946, so for almost 65 years now, we've been committed to the best, most innovative cancer research, so almost for 65 years. So if you have had a mammogram, if you've had a pap smear, if you've had a colonoscopy, if you've had a PSA test, probably not too many in this room, then research supported by the American Cancer Society, supported by relays, help to make those things happen. If you've taken a drug called Gleevec, if you've taken a drug called Herceptin or many others, again, research helped us support and bring those forward. if you have stopped smoking, if you have thought about losing weight or getting more exercise because it's good for you, again, ACS research helped bring those things forward. So if you look at the history of cancer research over the past 60 plus years, it's difficult to find any major development without a footprint in the American Cancer Society's research program. We've been very active and will continue to be active in that sense. One of the first people that we began to fund back around 1950 was a man by the name of Sidney Farber. Anybody ever heard of the Dana-Farber Cancer Institute? Yeah. So Sidney Farber was at Harvard, what became the Dana-Farber Cancer Institute, and he was a pathologist and a pediatrician. And he was interested in chemotherapy and interested in disease. And he is often now referred to as the father of cancer chemotherapy. He's called that because he's the first individual that treated a cancer patient and was able to induce remission in that cancer patient. He used a drug called aminopterin to treat a child with acute lymphocytic leukemia, and he was able to get several months of remission in that child and subsequent children. Now, aminopterin is just a folate derivative. Anybody know what folate is? You need folate. You can get your leafy vegetables, and I guess fortified breads. So he was using a derivative that inhibited the use of folate, and in doing that, he was able to induce remission for acute lymphocytic leukemia. Now, around 1950, the 5-year survival rate, which is often a way of measuring our success in treating patients, the 5-year survival rate for acute lymphocytic leukemia was essentially zero. It's essentially zero. Well, today, if you're less than 5 years of age, the 5-year survival rate for acute lymphocytic leukemia in children is about 94%. 94%. So essentially 0% 60 years ago when we started this, and now it's about 94%. So when people ask you the question, when are you going to cure cancer as if it's one disease? The answer to the question is we cure it every day, but we just don't cure every cancer. And so what we're all about here is trying to cure every cancer, not just some of them, really all of them. So I think Sidney Farber really is a testament to that desire. Research is often thought of, or science is often thought of as complicated. We have all these fancy words, we have impenetrable terminology, we have fancy concepts and things. But for cancer research, it really boils down to 5 questions. There's really just 5 basic questions we're asking. What causes cancer? How do I prevent cancer? How do I detect it? How do I treat it when I find it? And ultimately, how do I ensure the best quality of life for cancer survivors? So everything we do, all those complicated words and technologies and everything, it boils down to asking those 5 questions in some fashion. Now, at the American Cancer Society, we've set up 2 types of research, 2 broad types of research programs, what we call an intramural research program, which intramural just means it goes on right in the building a few miles from here downtown across from the Centennial Park. So it's the intramural group, it's the group of researchers that actually work right in the National Home Office of the American Cancer Society. Principally, they're involved in epidemiology and surveillance research. All epidemiology means is it's studying different factors and their association with cancer, obesity, smoking, things like that. And surveillance really is about measuring these changes in incidence and mortality in cancer over years and over decades. Because as we see changes in mortality, we can better understand what we should be doing and what we shouldn't be doing. So an important part of what ACS does is the intramural program. Now the intramural program together with the extramural program were both actually established in 1946. So both of these programs, and I'm going to tell you more about the extramural in just a second, both have been around now for almost 65 years. So the intramural program is inside, the extramural program is outside by design. But what that really means is we take money from raised at relays and many other ways, and we look for the best research and the best science to invest in. And we do that in institutions all over the country. We find the best scientists, the most innovative scientists, and the most innovative and valuable science that's likely to be a benefit to cancer patients at some point in time. And we invest the donors' dollars in that best research. So how do we do that? So you send the money to me and I decide what the best science is. No, of course not. What we do is we bring in the best experts from all over the country. They volunteer their time because they're committed to ACS as well in the mission. They volunteer their time and they say, this is the best science, this is the best scientist, this is where you should invest your money. And as a consequence, we We have a tremendous reputation internationally as a high value peer review, so-called peer review system. So that's the extramural in that branch of the organization, and that's where I work. And we're really excited about the type of research that we're able to fund by using this type of system. Now we can't possibly fund everything, but one of the things that you should realize is that we try to fund the best possible science no matter where it is. It might be at the University of Illinois, it might be at Harvard, it might be at Emory University. So we're trying to fund the best possible research no matter where it is. And as a patient or as a family member of a patient, what you should understand is that the society is really committed and hopefully will remain committed to leaving no stone unturned when it comes to research. We will look anywhere and support any type of research that we firmly believe will benefit cancer patients at some point in time. Now, let me give you a couple of examples of how the ACS plays a leadership role in terms of research. And to start off that discussion, and just very briefly, to start off that discussion, I need to give you some context about budget. Everybody loves numbers. So the